Hello, good afternoon. Welcome to this session H4 on developing leadership for quality improvement. My name is Robert Varnam. I am a primary care physician in central Manchester in England, and I'm clinical lead for primary care and commissioning at the NHS Institute in England. A couple of things to say first of all. This session is not quite as you may have expected it if you've read the full details on the website. It was originally intended to be a comparison of the current state of quality improvement development in leaders across different countries. Regrettably, I'm the only speaker from around the world who's been able to join us today. There have been a few technical difficulties and illnesses have intervened. So rather than having a 1-hour session and a panel debate, as you may have read in the full details on the website, I'm going to share some thoughts about where I see us currently being at with leadership for quality improvement. I'm going to share some of the experiences which we've had in England over the past few years and link that to some of the recurring themes which I think are very helpfully coming up in this conference. And then we're going to have a chance to hear your comments and your observations and your experiences, and I'm fully expecting we'll be able to finish ahead of time, which may be a record. We'll see if we can manage it. As I say, I'm going to speak a bit from personal experience as a quality improvement leader, but also from the experience of the NHS Institute in developing leadership and quality improvement capability in a variety of different settings in the UK and internationally, and in different sectors. So I hope this is going to be relevant for you regardless of where you work, regardless of the journey you've been on so far. And I think it's going to bring together some of the reflections. What I'd like us to end with actually is an opportunity for us to make some personal commitments to ourselves and to our patients. We're going to ask you at the very end to say, what will you do in the next 30 days to make a difference to improve safety and quality and patient experience? And then also, what do you need in the next year to help you develop even further as a leader of quality and safety and patient experience? I don't know how many talks you've been to or how many books you've read about leadership, but in my experience there are probably more different views of what leadership means than there are people who talk about leadership. And possibly even more different views about leadership than there are people doing leadership. It's a fascinating term. It means different things to different people. But one of the questions which we've been grappling with in the UK over the past year, and in view of our health reforms, is leadership of what? Leadership for what? Leadership why? Leadership of whom? And I think there's been a real explosion in people who are seeking to answer that. And you may well have been to some fantastic sessions already today, there was a great one, during this conference that ask and answer, to some extent, a lot of these questions. For me, this began as an interest as I first got interested in patient safety. I first got really interested in patient safety as a junior doctor when I inadvertently prescribed a dose of penicillin for a 3-day-old baby that was 100 times what it should have been. I'd previously had no interest in quality or safety. I knew what my job was. It was to know things and look after patients and nothing else. That began my interest in patient safety, and it was a very painful introduction to safety and quality. And I think for many people in healthcare, if you're a healthcare professional, that was probably your first introduction to questions of safety and quality. And it was probably just as painful and embarrassing for you as it was for me. I felt totally rubbish. I felt worthless. I felt like a bad doctor. I felt like a bad person. And many of us feel exactly the same way as we encounter these issues for the first time. I picked up my interest later as I began doing some research training, and first in a statistical background and then in a sociological background. I looked at these questions of safety and quality and how we improve them and what they mean. And I was very much influenced by Professor Jim Reason, who was a professor in Manchester when I was a student doing my PhD there in patient safety. And this brilliant summary by him of what we know about human error and the involvement of systems improvement in improving patient safety. This concept and this quotation had an enormous impact on me, and if you've done any thinking or reading or working in patient safety, you've probably had a very similar experience as you've encountered Jim's work. I was worried about patient safety because I had let my patient down. I wondered what was wrong about me. I wondered what could be better about me. How should I be better? How could I improve myself in order to stop misprescribing? And it was only as I began to look at the world of systems improvement that I realized that there were opportunities to do better without beating myself and without feeling so laden and driven by guilt, without taking such a personal view of why things work or why they don't work. Actually, I could look at the systems. I could look at the environment in which I worked, the environment in which my colleagues and your colleagues work every day. And so for much of my early time as an improver, and then as a researcher in improvement, and then as a trainer in improvement, and if you cast your mind back 10 years, think about what the improvement world was talking about 10 years ago. It was very, very focused on systems and technical tools and numerical, systematic approaches to improving systems of care. And I love this stuff. And we in the UK have found it enormously powerful to take some of these tried and trusted tools, developed mostly outside healthcare, probably exclusively outside healthcare, and help hospital teams and community nursing teams and mental health teams and primary care practices look at, understand, and improve their systems of care. And we've had great successes. And you may have heard about some of those successes in the press and in events like this. It's great to share our stories of how, when you pick one of these tools, and I think you can start in all sorts of places in terms of what takes your fancy, but when you pick one of these tools and you apply it to a system of care or a process of care, great things happen. The wonderful thing for me as a physician who works with patients who don't often get better and tries treatments that don't often work, is that actually this stuff works. Leading improvement in systems of care makes a difference to those systems and makes a difference to our patients. PDSA, in the Model for Improvement, is a really powerful tool and it works. Driver diagrams are a fantastic strategic development tool. Pareto charts are a very, very helpful diagnostic and prioritization tool. This stuff works, it's great. I'd like you, though, for a moment to think about and imagine, perhaps, the team you work with. Think of the people that you work with. These are some of the people I work with. This is my team. My team is small by international comparisons. We're a primary care practice. We have about 55 staff. We went on a journey a few years ago of trying to improve first the safety, and then the quality, and then the access to our care, using some of these fantastic tools that people around the world are applying to their systems. And it went very well. It went very well indeed, but it wasn't half hard work. And it took me a long time to realize why, because it felt as though I was doing all the work, and it felt as though I was driving things, and I was coming up against barriers and opposition, and to be honest, mostly apathy, a little bit of sabotage, almost on a daily basis, and sometimes just on a weekly basis, but that's draining enough. And the effort it took to be a leader of the systems in our practice felt pretty heroic. And I kept it up for so long, and then I couldn't keep it up any longer. And I had to stop. And I work almost every week with at least someone, and sometimes whole teams, who've had exactly the same experience. That leading improvement in the systems of care is seriously hard work. And there are clinicians who come to me and say, look, I thought being a doctor was hard, or I thought being a nurse or a therapist was hard work, until I started doing this stuff. And this really is hard work. And I've never been so exhausted, and I've never been so drained. And I found myself, and I have discovered as I've been working with people around the world on quality improvement and leading improvement in systems, that we often find ourselves designing a lot and doing a lot, but perhaps not fulfilling all of what we keep hearing is the promise of leadership. I don't know if you've heard the saying that a leader is someone who has followers, and a leader without followers is someone just taking a walk. Well, I think for many of us, we feel or fear, and to some extent might actually be people who are going for a walk and doing great things but not having the impact we expected. Doing great things but it not spreading as we really think it ought to. This is a brilliant idea. And we've got the data, and we've got the system plan, and yet it's such hard work to get those results. And you may have been in sessions where people have presented their processes so far and their achievements, and the challenging questions are actually about the outcomes. We do great things, and they don't really achieve success on the scale that we expected or the scale which we hoped. And it could be today that you're feeling a bit like this. It might actually be your head is buzzing with ideas and you're bursting to try some of this out. But this is a really common experience. The people who lead improvement in systems find it hard going, even though the tools we know are brilliant. And I think the challenge for us, which is beginning to be talked about, has been for the past year or two, and I think needs to be much more prominent in the way we approach improvement, in the way we approach leadership, is that you can't have improvement and leadership separate if you want to have great impact. Actually, we need to marry the two together. And for me, the big journey of the last couple of years, and for us in the NHS, the big journey of the last 2 or 3 years, has been discovering ways in which we can marry up the human and the system so that both benefit. To find where the synergies are, to find the techniques and the methods that are leadership methods for improvement, that marry them up like that. Because the reality is, we need to do both the connecting with people and the PDSA. We need to have great data and great stories. And if that feels like an awful lot of stuff to get right simultaneously, I think the answer is yes. That's right, it is a big ask. It's a huge task to do this. However, I think that if we marry up these worlds of system improvement and leading people, hearts and minds, connecting with values, that actually we can help both of them be more successful. And actually, I think that makes it easier. And our experience as we're starting to help improvement leaders join up those two worlds, which can be seen to be in opposition, that actually the systems work gets easier. And it seems to deliver better results. And the leadership seems more meaningful, and it drives forward, and it seems to come at less personal cost. And perhaps sometimes it's more focused, and we don't have to worry so much about our position. Because one of the interesting things that I've been hearing around the conference so far, and you may have had similar conversations, is people saying, well, for the folk around me, it's all right, but actually, if I only had a higher position, if I only had greater power or greater authority in our organisation, I could get so much more done. Because the powers that be, the chief executive, the directors, if only they were on board, they could make anything happen. They could wave their magic wand and everybody would follow. Well, I think that's a common experience. Most of us are not at the top of the tree, whatever the top of the tree means. And so we have to find ways of using the system tools and the leadership tools in a way that's more encouraging. And the good news is we're finding, I think we're still on a journey with this, we're finding that it can work. But first I'd like you to pause for a moment and just reflect. I'd like you to think about the last time you began a piece of change, whether it was a huge program or a small incremental change. You suggested a change to other people. I'd like you to cast your mind back to that. Close your eyes if it helps. As you first told people about it, how did they respond? Positively? Negatively? Ambivalent? Somewhere in between? Undecided? How do people generally tend to respond, in your experience, when a change is suggested? It's quite dark in here, but I think we can see each other well enough. I'd like to ask that if your experience is that generally, when a change is first suggested, people are positive, I'd like you to raise your hand now. Let's have a look around the room. So if generally speaking, people are positive in your experience, there's a few hands. Okay. If generally speaking, it's on the left, it's negative, would you raise your hand? That's way, way, way more hands. And if generally speaking, it's ambivalent, would you raise your hand? Okay. So perhaps 95% of us don't have a particularly positive experience of suggesting change. And that's irrespective of the fact that we know that us in this room come from every hierarchy. Some of us are the boss, and some of us are decidedly not the boss. And yet our universal experience is that proposing change to people is bad, is difficult. Now, why is that? Is it because you just can't come up with good ideas? It's a possibility. Is it because things can't actually be improved in your setting? The way things are today is the way things will always be, and that is just tough and we're going to have to live with it? Probably not. I'm prepared to bet that you have great ideas. I'm prepared to bet that things where you work could be better, that care could be safer, it could be more efficient, we could give a better experience and better outcomes to our patients. And yet, people don't see it. And yet, even if they see it at the outset, do they still see it in 3 months' time? Are they still with us? 2 years later? 3 years later? Is that change sustained? The brilliant system we've designed doesn't always get followed or accepted by the people we have to engage with and the people who actually are the system. So, is this a universal experience? I think it is a universal experience, and here's a beautiful illustration of the problem, and I hope the technology works, because it let us down earlier.
Redbeard, do you think if I finish chipping this flint by a time when sun is hottest, you could get it tied to a stick by a time when we all get hungry?
I don't think so, Big Feet. You're forgetting. Today we've all got to go to clearing where we go sometimes, from time when cricket shut up until time when we go back to our huts.
Really? What for?
It's Bronze Orientation Day.
Oh, bugger. I'm so sick of hearing about bronze. Bronze, 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 bronze. What's wrong with stone? Does stone not work all of a sudden?
Well, they say that bronze will revolutionise the way we hunt and gather.
Well, maybe, but I can't be doing with it. Horrid, shiny stuff. Duh.
Guys, this is Hairy Back from Tribe in the Valley who have lots of jewellery all of a sudden. He'll be leading our Bronze Orientation Day. Hairy Back, this is Big Feet and Redbeard, our foremost chipper and tire.
Oh, great. Well, you're exactly the kind of people I need to get through to. And my message for you is this. Don't be afraid of bronze. Really. Unless, of course, someone is attacking you with a bronze axe, in which case you should be afraid, because bronze is brilliant. Meet bronze. Bronze is your friend. Bronze is user-friendly, multi-purpose, exciting, zeitgeisty, and most importantly of all, it's slightly shiny. Every day we're finding new uses for bronze. Bronze plates, bronze cup, bronze hats, bronze shoes, even bronze windows. And bronze doesn't even need to be chipped. So, stone is dead. Prepare for the age of bronze. Thank you. Yes, you have a question?
Yeah. When you say bronze doesn't need to be chipped, right, my question is, doesn't it?
No. With new modern smelting, old-fashioned chipping is a thing of the past.
Right, because I'm a chipper, you see.
Right, well, I won't lie to you. Chippers, as a breed, are going to go the way of the saber-toothed tiger. No, I mean they're going to be extinct. But have you thought about retraining as a smelter?
No, I haven't. I mean, smelting may be fine for the lads, but I'm no smelter. And while bronze may be terribly clever, stone was all my old dad ever needed to feed a family of as many hands as I have and then more than that. I just say, as a tribe, why don't we leave the bronze to the smart Alex and the whiz kids, and we'll just carry on using stone axes like we always do?
Because if you do, the tribes with the bronze axes will kill you, and then take your stone axes, and then throw them away because they're rubbish.
Oh.
Yes?
Will the bronze still need tying to sticks?
Oh, yes.
Cracking.
Apologies if you struggled with the accents there, but I think that's a beautiful illustration of the experience many of us have of taking our beautiful ideas to our colleagues. And it illustrates something which has been described in a variety of pieces of social psychology, but which I think we as improvement leaders are only just beginning to do something about. And here's one. You may have come across the AdCar model from Jeff Hyatt. This is from the business world. And it makes this point that change is not what achieves results. Change and people are what achieve results. And so he says we need change in systems on the left. We need this systematic, this scientific, this rigorous, highly skilled approach to understanding need, getting a concept, refining it, designing it, attending to implementation and post-implementation. These are vital. And without these, you cannot succeed at achieving great change. However, what we often don't attend to alongside that is the change in people which is necessary to reach that result as well. That actually, unless people have the awareness of the issue, the awareness of the need, the desire to change, the knowledge about what is needed to be done, what is needed to be done by them, the ability to participate and support your change, and then continual role modelling and reinforcement of that change, you're unlikely to reach the result that you were hoping for. You might achieve some result, but it's unlikely to be the fantastic effect that you expected when you attended to your change in the systems on the left of the diagram. And actually, this is borne out by a lot of research in business and in industry. It's an observation that you will possibly recognise in your own experience. And it may be that the culture of your organisation leans one way or the other. The culture in your team leans one way or the other, or perhaps even your personal preference or your approach as an improvement leader tends more towards the systems side or more towards the people side. And the uncomfortable truth is that we need to marry the two together. We need to create and exploit the right balance of synergies between them. And probably we need to have methods of change and systems of change which ensure that we never miss out one or the other and ensure that we take both of them step by step by step. There's a sense in which this is a linear process, both in the system design and in the change in people. And so I'd ask you to reflect as you think back to the last change you initiated and you began, your organisation did. Did you have the same kind of plan for the people as you had for the system? If you're more of a systems person. If you're more of a people person, had you been doing the systems design alongside your great work with your people? We have to have the two together. They are synergistic. The reason why this is often difficult for us as leaders is as follows. You've discovered a beautiful desert island. It's wonderful. You love the sun. You love the solitude. You love the sea. Sitting on your desert island is just fantastic. It's the way you were meant to be. It's the way everyone should be, surely. This is where the future is. This is the change you're proposing to people. It's wonderful. It's great. Everyone should be here. The likelihood, though, is that the people you're speaking to, your colleagues, are in your little harbour I've drawn. They are safe to some extent. They are in a place they know. They are used to it. And you're calling them out on a journey. And the thing is that if you're safe in a harbour you know, possibly even a harbour you helped to construct a year or two ago, then for someone to suggest that actually desert islands are much better might not seem that appealing. And the reason is, and this is something we often forget, it's not so much they are rejecting the change, or they are worried about the change, or they don't like the change. It's they're worried about the journey. They're worried about the transition from where they are now to where they are going. You are here already. Forgive the misorder of slides. Our chap who was unhappy is on the left, and our chap who is happy is on the right. And it's got nothing to do with the change, because the change suggested to both of them was the same. So what does this mean? Let's look at this model a bit more carefully. Kurt Lewin, a social psychologist in the 1950s, observed the phenomenon in a variety of different settings across the world, that while you can implement a change like that, the people have to go on a journey. And that journey is not neutral. That journey is not unproblematic. That journey is not all about the change. It's about me and the reasons why I don't want to go on it, the reasons why I'm worried about it. And to understand this journey, we need to apply, or we can apply, a variety of different pieces of what we know about people and what we know about their understanding of themselves. But it goes like this. To leave the harbour may sound like you to be obvious, may sound like you to be a new beginning, but for me, safe in the world I know, actually this is a letting go. This is a death of something. And the reason why in that video clip it was particularly hard for the man on the left is what you're describing, this new world of bronze, a beautiful change, why wouldn't you do it, actually represents the end of his family tradition. It actually represents the loss of his purpose, the loss of his job. And put like that, bronze doesn't seem very appealing at all. And you can talk to me about the brilliance of it, you can talk to me about the multi-purpose, you can talk to me about the inevitability, this is the new way, everyone else is doing it, why can't you? The answer is, well, for me personally, that's letting go of too much. And at the very best, it's going to take me time to travel that journey. But if you don't take account of the fact that for me this is a letting go, this is an end of something, you can talk about brave new horizons and new beginnings all you like. For me, actually, I'm dying of something. How often do we take account of that when we're starting something new? I don't know it's that often. In my experience, in my observation, the people we work with, you examine the problems of things that have stalled or taken way too long or achieved way too little. And you ask, who are the people who are not with you? What have they had to let go of? What are you asking them to leave behind in order to come with you on this journey? Actually, you start diagnosing things very differently. And you may already be noticing things different about the last change journey you went on. Think of the people who were most oppositional. What did they have to lose? Often the answer is they had to lose a lot. And it was very personal. And there are parallels here, which may be occurring to you already. Let's examine some of them. This model was developed originally by Kurt Lewin, but it's been popularised by William Bridges. And if you want a lovely introduction to this concept, William Bridges' book about transition is a really nice, easy to read. It's lovely, some great examples. He's really popularised this idea of transition that we have to go on and the journey that people have to go on in order to reach your change. A point before we move on is that some people will be there almost in an instant. They can straight away say, yeah, this is great, I'm here, I'm in a new beginning, this is great for me. I can go instantly from the old way to the new way. They're lucky, they are the minority. For most of us, there is a journey, a transition to go on. And you may be seeing some parallels with, if you're from a clinical background, you're kind of beginning to get your diagnostic hat on here. The Kubler-Ross grief model, the transitions that people go through when a loved one dies, when they experience bereavement, are often quite similar, surprisingly. It's not surprising at all, to this observation that we go on a journey, that we go from a stable place to feeling immobile, to having denial, feelings of anger. Sometimes people bargain. How many times have you begun a change process and people have been bargaining with you? Can't we just keep a little bit of the old? Could our team here just keep doing it the old way? Why can't we blend the two? Why do we have to be all or nothing? If those are the kind of things you've heard, this is a grief reaction in the people that you're trying to lead on this journey of transition. And sometimes there is depression. And eventually, the good news is there is acceptance. What we know about grief is eventually there is acceptance. For most people. But don't assume that. People sometimes need help to get through this. This isn't just a matter of waiting for everyone to catch up. So I hope, as you're reflecting now on your own experience, perhaps you could think of the people around you at the moment, the individuals around you at the moment, in the changes that are going on in your workplace. Where do you think they are? Are they in the ending, losing, letting go phase? Are they already in the new beginnings? Are they basically performing with the change already? They're there, they're doing it, they're living it. Are they somewhere in between in that neutral zone? It's a great template, I think, this, for us helping to understand where people are at. How about groups? Because sometimes this isn't a matter of individuals, sometimes this is a matter of whole groups. Is the issue here that for the therapists in your hospital, this change is going to be very threatening? Sometimes it's a whole group. Where are they? Where are the nursing staff? Where are the operating department staff? Maybe it's a whole departmental issue. It's a great template for diagnosing what's going on. The good news is, this is also something that helps us with that challenge of marrying up the system and the people. This isn't just about diagnosis. We can actually use this for deliberate design of our change programs so that we attend to the people's transition as well as the great change that we're aiming for, that beautiful desert island, or the implementation of bronze. And the nice thing is that we're beginning to find that some of the most powerful tools, the most ready-to-hand tools for deliberately designing this transition, making it easier for people, are probably ones that you're already familiar with. And some of them come from the world of social movements, and some of them come from the world of systems improvement. So let's just have a look about how we could do some of this. What you're trying to do is get people to follow, to buy into, to move towards your beautiful vision of the future. And sometimes, by itself, that's enough. But we know from experience, and we know from evidence, and we know from improvement leaders around the world, that that vision of the future doesn't just happen. That vision of the future has to be created from hearts and minds. It has to be created from our values and based in our values. This vision of the future has to speak to a shared purpose that we have in common, or it's unlikely to be an attractive vision of the future. Because us as improvement leaders, we tend to be people who like vision, and we buy into vision, and we love it, and a new vision is always inspiring, or almost always inspiring. But an awful lot of people actually find new visions almost always disturbing, or worrying, or just they switch them off. So your vision of the future has to be a good one. It has to connect to people's values, their feelings, as well as their mind and their understanding. It has to generate hope, actually. I think one of the biggest challenges in getting systems improvement implemented well and sustainably is that people lack the hope that it will really achieve better things. We have a great deal of learned helplessness in healthcare. A great deal. It's not because people are belligerent that they fold their arms. Sometimes it's because they can't face being disappointed again, because it's hard to hope, it's hard to believe that the new thing really could work. So we have to be people who always growing our skills in building a vision of the future which appeals to people's values and their intellect, which creates a sense of common purpose, which connects to a sense of hope for the future. But that's probably not enough. We often need to push as well as pull. And so we talk about creating a burning platform, also one that connects with people's hearts and their minds. But how do we do that? Well, the good news is that we can tie up our leadership brain and our improvement science brain. That actually, how do you create a vision for the future? Well, you get stories that it could be better. You come to a conference and you hear about the changes in people's lives that have resulted from some great change. You say, it's not just theoretical. Listen to this story. I met this guy. I heard this woman speaking about it. Actually, sometimes, particularly if we're appealing to a certain type of person, we need to be talking about a vision of the future that has evidence to it. And I think the evidence-based movement has quietened down, as we've talked about other things in healthcare. I think it needs to be as prominent now as it was 5, 10 years ago. It's vital that we show the evidence that this change is going to be an improvement, that it's not just a change. And you may start to hear some of the systems improvement concepts coming in here. But I'm using these not as a strategic planning tool. I'm saying, how will you know a change is improvement? Because if you don't know, you won't convince people to come with you on this journey. You won't sell an attractive vision of the future. You won't help them go on this painful transition. And the same is true of a burning platform. Why should I leave my beautiful harbour? I helped build this harbour, and I've been here for 15 years. It's safe, it's known to me, I love it. I won't leave it, thank you very much. Well, we need to do the same thing. We need to have stories of what is wrong about the present state. And sometimes those stories are difficult to gather and painful to hear, but unless we are hearing the voices of our patients saying, I know you're trying well, I know you care, but this happened. And that happened. And to be honest, it almost always happens. We need to be gathering and telling and sharing those stories to help create this burning platform. That's the really great way into people's hearts. But we should also have data. We need to be having really good baseline data to understand where we're at, to show the case for change and create that burning platform. We probably need both push and pull every time. And the good news is that in doing this complex, interwoven, simultaneous design of the system and engaging of the people, actually we can use improvement tools to help engage our staff. We can use improvement tools to demonstrate that our vision of the future can work. How do you know it's better? Well, some of us have been trying it out using little PDSA cycles. And it's small scale, but so far we've found that if we've ironed out these 2 or 3 problems we found over the last 2 months, hey, it works. Here's the data. Here's the run chart. How do you help people engage in the big picture when they can't see the future vision? Why not use a driver diagram? I've found driver diagrams to be not just a great strategic planning tool, but one of the most effective change leadership tools for engaging hearts and minds, for people who are confused and worried and don't know where they're going to sit and are worried about leaving and worried about arriving. Actually, these tools we know and love from improvement science can be enormously powerful as hearts and minds agents. And then through it all, we have to be people who are continually growing in our ability to tell the right stories, to connect with people's vision and values, to create this sense of purpose. And one of the many reasons why that's so important is the people you need to come with you may not work for you. And frankly, even if you're the boss, the people you need to go on a transition to implement your new change, they may work for you, but you don't own them. And wherever you go, however far high you rise, there is nobody on the face of this earth who can get everybody to do what they want. So that picture of the boat, actually it's a rowing boat. We do lead by commitment more effectively than we lead by compliance. It's a painful lesson to learn for those of us who've occupied more senior roles, who've got used to positional leadership, to realise that people traverse this transition journey in a rowing boat. They are rowing themselves. They're going with it if they believe in it. And you can coerce them only so much. Leading through compliance may be the prevailing way of doing large-scale leadership in hospitals, in healthcare systems, in nations. It's just, it doesn't work as well as we need it to. If we're to get the kind of improvements which I suspect are burning in you as a result of being at this conference, we need to be leading through commitment much more than through compliance. And the nice thing, as I said, I'm not going to labour this point now, is that PDSA, the model for improvement, was introduced to the world as a method to do systems work better. It's a disciplined, reliable, structured approach to getting better changes. And we should be using it. We absolutely should. And if you need to read about it as a result of being at this conference, do. If you need to go on a training program, do. Because this works and it will get better results. It gets better system design. It's a better way of implementing change and testing it. But you can also use it beautifully to show people what's wrong with the present state. And you can use it incredibly powerfully to show them what the future could be like. Why is this change better? People often ask you. I don't believe this change is going to be better. We've tried things before and they've just been changed. It's just been hard work. Why should I leave the comfort of where I am now? Try some PDSAs before you take it to people. Say, this is our experience, these are the patient's stories, and here's the data to show that the new change is an improvement. This is a person leadership tool, as well as a systematic change thing. Exactly the same for driver diagrams. I think you can do almost anything with a driver diagram. I'm a massive fan of them. This is one that we used in our practice at a time of great pain, when our patients were unhappy, and our staff were unhappy, and some were leaving the practice because they were so unhappy, because our quality, our safety, our access, our efficiency were all suffering, and we needed to make massive change. But we'd all tried before, and it was too difficult to go back to that hard work, pain, personal effort. And we used this drive diagram to help us take all of our change project ideas, marshal them into a sensible order, and see how they contributed towards the goal. It helped us get greater clarity about the goal. We developed this in team meetings. We had 40, 50 people in a room designing this together. The conversations that were started and maintained as a result of this process kept going for weeks and changed people's sense of possibility and hope. It improved our teamwork. It helped everybody in the team understand where they fit. When we said we need to prioritize just 2 of these to begin with, people were accepting of that, finally, because they saw that theirs was on a list and that it would be addressed eventually, and that at least the ones we selected were contributing to the goal we'd set ourselves. An amazingly powerful tool. And it was introduced to the world as a strategic development tool. Do your systems thinking right using a driver diagram, but as a means of engaging hearts and minds and building will and a sense of shared purpose and a sense of hope and possibility. Driver diagrams are absolute dynamite. And again, if you need some experience in using them, in coaching other people to use them, get it. It will be time well spent. So as we think about the challenge of taking people on these transitions, the good news is that we can use the same deliberate design principles that we'd use for a change as we can for a transition. Quite encouraging, I think. We can use some of the same tools as well. A quick word about the neutral zone. I'd like you to imagine that people have at least begun contributing to the change. They've begun moving out of their safe haven, and they're on the journey towards this new vision that you've outlined, or perhaps collectively we have outlined. How does it feel in that space, and what should you do? Well, the commonest description of this space is being lost at sea. It's a place of uncertainty. The old has gone, but we've not arrived yet. We're in some in-between space. some frightening space for many people. Now, for some people, that's a wonderful thing to be lost at sea. They love it. It's actually really helpful to recognise where people are. It's really helpful to pick up on the clues, to diagnose when people are in this neutral zone and full of uncertainty. And I think there are two big design principles we need to bring in as improvement leaders when folk are in this neutral zone. The first is around teams and relationships. This is a time when it's really important to be pulling together, to be communicating, listening, hearing people. This uncertain place is not necessarily a bad place, but it is unsettling for many, many people. And the second is, actually, this is a great time to be testing things out. This is a great time to have multiple different PDSA ladders running. Hey, I wonder if, let's test it. Do you think that perhaps, let's test it? Would it perhaps be better if, let's test it? A time of uncertainty can be a time of great creativity and innovation, and a lot of great innovations come in teams out of this stage, particularly if we use it positively. Acknowledge we're still driving forward somewhere. We're not going to go back. We're definitely not going to go back. We're going forward together, but let's innovate. Let's test things out and experiment now. Great time to do this in the neutral zone. And one thought just about new beginnings. When you reach new beginnings, that's great. Really important to celebrate it. Put a marker down, have a party, celebrate your new identity, make it part of the new culture. Really important. But do bear in mind that not everyone else has arrived yet. You are here. It's possible that even the majority of people will be here. But there may still be some in your team, in your organisation, who are still actually in the zone of ending, losing, or letting go. And there are likely to be quite a few people who are still in the neutral zone. So as we think about new beginnings, just one thing, sort of in the interest of being humane, really, and kind, it really is important to do the things we know about marking new identity. Social change theory really has a lot to add there, but so does a bit of compassion sometimes need to be brought in at that point. So does this feel like an awful lot of different tools to carry simultaneously? Does it seem like this is a just almost ridiculous multiplicity of ideas? I hope I've shown that actually there are lots of different things here, but they do work together. And if you do put them together, our growing experience in the UK is that it works. This is a map of a programme I lead on quality improvement training. And you'll see there's an awful lot of stuff on there. And some of it is about designing systems, and some of it is about connecting with people and building culture and supporting people through transition. And I don't think any part of it is optional. I'm proud of the fact that we've got this confused, seeming, great mass of different things together. We have found, and we've been testing this for a number of years now, we've found that if you attend to all of these, things go pretty well. If you attend to some of them, things might go pretty well, but you can't guarantee it. We need to marry up the system design and leadership, the change, with the people and the transition. Where are you as a leader of improvement on this tree? How do you feel as you look at this tree? How do people around you see you on this tree? Where should the leader be? If we had a different room, it would be great to have a conversation about that, wouldn't it? To share our ideas on where the leader should be, share our feelings about where we are. One of the most beautiful things in my journey of discovering the power of improvement science to engage people was when one of our junior clerical staff thanked me for having changed her job and transformed her experience of work. And I was a little baffled because I'm not her line manager. And it was simply because we'd introduced PDSA cycles and a culture that said, if you've got an idea, try it out. Discuss it with someone, but try it out in a PDSA cycle and measure it a little bit. And for her, that had transformed everything. But the real thing that had was the fact that she now felt the ability to show the others. So when a new person came, doing a relatively innocuous and very much back office function, she would tell her about the possibility of doing this stuff. And she now explains the model for improvement. She's never had any training, she's just lived it. And she is now an improvement leader. She spots things that could be better. She tries something out if she's got an idea. She asks other people what their idea could be. Not so great on the computer, so she has graph paper, and she maps out a run chart, and somebody else does the statistical process control for her. But she is now an improvement leader. No position, no authority, nobody works for her. She's pretty much bottom of the rung in the hierarchy of things, but she's an improvement leader. Where are you? How do you marry up the leadership and the systems improvement? I'd like you to pause and think what ideas you've heard, and I'd like you to turn the ideas of this week into plans. We're going home in a few hours, and the conference will be over, but work starts again, well, perhaps tomorrow for you, or Monday morning. I will do what in the next 30 days? As a leader of quality improvement, I need what? Ideas, support, somebody to come with me, a book, a program, a spreadsheet for statistical process control. Don't leave here at the end of today, in a couple of hours' time, without a plan to turn these ideas into something. And if you have a plan, I'd really urge you to make sure it's one that marries up a brilliantly designed, rehearsed, mapped out, evidenced new change, and the story that's going to help people who've got lots of reasons not to come with you, to come with you. I'd really urge you to have a plan by the end of today for joining this stuff up, because actually, when you do, it works. And I wish you very good luck with it. Thank you. I'm conscious of time and the fact that it's great to try to keep to time in events like this. So I'm going to suggest, if you want to chat, I'm going to stay down here for a bit. Come and chat. But otherwise, I don't think we'll do the big open panel thing, because I think it's quite helpful to, let the program run on and keep to time. So thanks very much. Have a great rest of the day.